If you work in a school district right now, chances are you're having conversations about student safety and prevention and what's expected versus what's actually realistic. We're not here to rush a conversation or turn it into a pitch. We're here to make space for it. I'm Amy, and I've joined Standard Education because of the work they're doing with educators who understand both the classroom and the administrative realities of student safety. One of the reasons these conversations feel especially urgent right now is a shift toward behavioral threat assessment and prevention, and the new expectations districts are navigating as a result, including state-level requirements like Georgia's HB 268. That's why I'm really glad to be joined today by Stephen Hornyak. Stephen brings almost 2 decades of experience in K-12 education with a doctorate and hands-on work both in the classroom and district administration. He's lived this work from every angle, and his perspective helps ground these requirements in what's actually possible and sustainable for districts. Stephen, before we dive in, I'd love for you to share a bit about your path in education and how working in the classroom and administration shaped the way you think about student safety today.
Yeah, I want to start off by saying thanks for organizing this conversation, Amy. I think it's really an important conversation and more relevant today than it's ever been. I consider myself to be a bit of an accidental educator. Although my mom and her 3 sisters were all educators, I never thought I'd be in the classroom. My background is in risk management in the business world, and after a short stint in the corporate world, I found myself looking for another opportunity and became a teacher. I fell in love with teaching high school math and did that for several years before going into administration. At the central office level, I've held positions as a system intervention specialist. My heart is really in intervention and helping at-risk students and really supporting all students. I've worked in data governance, learning analytics, accountability, and in that work, I've done a lot with data, predictive analytics, and risk modeling. Today, I serve in a Chief Innovation Officer role in my district, where I'm able to really push the envelope on the things that we do. Safety is one of the things that's a top priority for every district. It's something that's difficult to grapple with, particularly in the environment that we've found ourselves in, particularly with the legislation that's recent legislation.
All right, well, great. But thank you for that background. So you've been living inside school safety and BTAM for a while. What feels different right now compared to even a few years ago?
Yeah, it's a lot of districts are grappling with different types of behaviors. We've seen a large influx of students really grappling with mental health. The rapid evolution of technology and handheld technology like mobile devices has really created an atmosphere where students are suffering in silence sometimes, and it takes a while to surface some of the issues they're having. They sort of boil over into arguments or disagreements or fights at school. But in my role, we're really more focused on trying to make sure that we can identify who the students are that need support. Particularly with House Bill 268, districts across the state here in Georgia and really across the nation are expected to demonstrate structured behavioral threat assessment and management processes. And although most educators would say they value early identification, it's now being mandated, and the pressure has shifted from just responding well to behavior incidents to proving that you're prepared for something when it happens.
So who, when districts talk about school safety, who's owning these decisions, how they respond to school safety?
I would say for the most part, the front lines in school safety really happens at the school level, with school level administrators, support staff, school resource officers, the counselors, and the like. But when safety lives in a single building, it becomes really personality dependent. When it lives at central office, it becomes more system dependent. And so you end up having issues with data sensitivity, like our FERPA implications. And so that's sometimes why SRO-led or AP-led models really break. And that's why a lot of these decisions are made at the central office level, because we want to ensure systematically that we're making sure or ensuring safety for all students across the district.
You mentioned SRO. Could you expand on it a little bit for the newly indoctrinated to these assessments?
Sure. So an SRO is a school resource officer. In most states, and particularly in Georgia, every school or almost every school has a school resource officer. And this is a law enforcement officer, of course, that's in the building or is in the building periodically. And they're there, to ensure the safety of the students. But again, in this historically reactive environment, they're there for when something happens. And so a lot of our systems depend upon the administrators in the building, the support staff in the building, and the school resource officer to respond once an incident occurs.
So I guess that would take us to why HB 268 has come about and how school districts should think about threat assessment rather than being reactive, being more proactive.
Yeah, and that's, I think, for us, introducing this whole language of behavior threat assessment and management. It exists on the national stage. There's a National Center for Threat Assessment. There are organizations that help with this, but it's tended to be more in law enforcement and municipalities. In the school setting, though, it looks a little bit different. For us, historically, behavior threats really have just been as they surface, an incident happens, an AP, a team, which may include the school resource officer and support staff, convenes, and then there's some sort of documentation or follow-up after. House Bill 268 really shifts that, though, and there's an expectation that we're attempting to mitigate or prevent those events from even happening in the first place. One way they do that, or the primary way that's written into House Bill 268, is an expectation of behavior screening. This also includes things like prevention protocols, making sure there are defined pathways when an incident, before an incident occurs, or when we see risk in a student, to escalate support for that student. And overall, House Bill 268 requires really consistency across buildings by having these behavior threat assessment management teams established at not only the school level, but also the district level.
So you've mentioned this behavioral threat assessment team. Who's usually part of that team?
It's a great question. So typically these teams may already exist in a building in practice, right? We might have an administrator that sits with the SRO, with a counselor. So the BTAM, though, especially as it's written in legislation, really requires a school to have administrators, counselors, a school resource officer if they're, other support staff, which could be other teachers. It could be some schools have behavior coaches. And so this team meets regularly to identify and to assess by analyzing data to determine where the behavior threats are in the school. Again, historically, these teams would look at data after an event. So we call it ODR, Office Discipline Referral Data. And that's been the primary source of data for these teams prior to House Bill 268. But House Bill 268 is asking for something completely different. It's asking, again, for us to move from a reactionary posture to one where prevention is really at the center.
How do we operationalize that reaction? Why is prevention harder to operationalize than reaction?
Yeah, reaction is event-driven. Prevention, though, is system-driven. And this is really important because oftentimes, I call it an identification gap. There are students that are suffering in silence, if you will, students that are struggling in our schools that haven't yet reached the level where they're ideating on those feelings that they have. And so this prevention stance really is to create a system or the infrastructure to have it in place so that we can make sure that we are actually supporting students before it rises to the level. So reaction activates when something happens. Prevention requires infrastructure, even when nothing appears wrong. Because those are hidden students that just aren't identified. It may not ever turn into a fight at school, but the student is suffering. They are having internalized and sometimes externalized reactions to the things they're working on through. So infrastructure requires staffing, it requires workflow, documentation, and also requires an alignment with leadership. And that's really where most districts undermine just how difficult this process can be.
I mean, it does sound difficult. How are, so I've heard you mention screeners before. So tell me more about these screeners that students, I take it, are filling out, or teachers. Tell me more about the screeners that help identify this risk.
Yeah, so universal screening is something that, as part of an overall multi-tiered systems of support, or MTSS process, is research-based. Here in Georgia, we have a really great infrastructure or workflow for that. But screeners help us determine where students are. Most districts use some sort of academic screener. These screeners are large norm reference assessments. They're given a couple of times a year, and they help schools see where students are in their learning. Behavior screeners, on the other hand, are something that do something very similar. They see where students are, but it's not academic. It's about their risk associated with, do they feel connected with the school? Do they have a trusted adult they can talk to? Do they have thoughts of self-harm? Do they feel bullied? Do they feel supported? Do they have a friend at school? And so these behavior screeners, though, traditionally, they're very clinical, and they happen predominantly after an event already occurs, or after a teacher sees a student exhibiting problems, or they have an issue with attendance, or but you can actually see them be withdrawn. So again, most screeners, even though they attempt to find these issues, they're still reactionary in some way. The other thing is that they do produce reports. A lot of them are paper and pencil, which is very difficult, even in smaller districts, and they don't integrate into a workflow. They don't adapt, and they certainly don't help triangulate data to look at how is risk across academics, behavior, attendance, and things like that. And so from a risk modeling standpoint, that really creates a lot of noise, signal noise. So you're either overwhelming staff at the school with false positive, or you just miss students who are internalizing entirely.
And I'm guessing students who a lot are probably very computer-based today, shifting to a paper and pencil, pen and paper format is not ideal.
Absolutely not. A lot of districts are now one-to-one with Chromebooks. And so it's just an easy place to assess students if you have it digitized. It also, of course, reduces a lot of the burden on the administrators, or those who are actually looking at the data. Of course, compiling it becomes really difficult when it's paper. So yeah, it can be a heavy lift.
So you mentioned earlier that you have a background in risk modeling. How are you applying your risk modeling background to this approach, especially if we're able to move data into, move these screeners into a more digital aspect?
Yeah, so for me, data is king. It's the thing I look for. I always say to people in our district, what gets measured gets fixed. And it's really important for us to identify these behaviors early on, but it is difficult, right? For all those reasons, the manual process, the screener being really more clinical and not telling us, or not being specific enough to identify what the student's actually struggling with. At some point after we had used a couple of these, I kept asking, why are we waiting for behavior to escalate before we look for patterns? We really need a tool that can help us determine who those students are, something that's given multiple times a year, but is quick. It's done on the student's device. It's analyzed in the background very quickly because it's all done digitally. So we were really looking for that kind of solution and couldn't find it.
Now, I'm not a teacher. I don't interact with school-age children very much. But the thing that I keep coming back to, and I've chatted with you about this, is how do you analyze the data? How does this work with kids who may not be forthcoming with how they're really feeling? Even if it's, in private, and I feel like that I can share, how I'm feeling disconnected, or no, I don't have a trusted adult. How do the screeners solve for that? Can you walk me through a little bit how that can actually identify somebody who's maybe trying not to be truthful?
Yeah. So in the state of Georgia, I can speak to, we have given a Georgia Student Health Survey, which now turned to a Georgia Climate Survey to all students in grades 3 through 12. And this survey is anonymous, and it used to be very lengthy. Now it's much shorter. But in our research, we found that students do self-report, and self-report really is important, especially in grades 6 through 12, because seeing and internalizing risk for a student is really invisible without it. Teachers can observe externalizing behaviors. They can observe ideation or emotional distress. They can't observe that if it's not expressed outwardly. And so if you don't ask students directly, you're really operating blind in one of the most critical domains. And our research has told us and shown us time and time again that students do self-report, and they are honest in these reports. And if we can, help even one more student, that really has, we've met the goal that we had in helping identify these students before they're in crisis.
So you've been working with the team at Standard Education to develop a screener for this. It's called Focus.
That's right.
Tell me more about Focus.
Yeah, so in my quest to create or to find a screener that did all those things, that was quick, was self-report, that allowed us to aggregate the data, triangulate it, and report it to our schools and really embed it into our workflow, I've found that there was really nothing in the market. My position in my district and my previous work, and even my experience all the way back to risk modeling, really puts me in a unique position to develop assessments. I've spent a lot of time with screeners, mostly academic screeners in the past, but over the past 4 or 5 years that we've worked through behavior screeners, we've just really seen that it doesn't exist in the market. There's not a tool out there that's adaptive, that pulls all this data in, and that allows us to ingest that data into our workflows and help students. It's usually an assessment is a thing we do, and then the data just sort of sits there. And so FOCUS, which stands for Factors of Concern, Understanding, and Safety, really help us identify which students need support and help us able to plug those students into a workflow so that the BTAM team, but also counselors, teachers, and administrators can really provide additional support for students when they need it.
And so how does, what happens if a student indicates self-harm or violent ideation? That's where the workflow kicks in, and the BTAM and the counselors are able to respond and reach out to the student?
That's right. One of the differentiators for FOCUS for other just general behavior screeners is that it's adaptive. And the adaptive nature of the screener means that once a student reaches a question that asks about self-harm or violent ideation or even witnessing violence at the school, it immediately flags them, and they actually opens up a sub-survey. We call the one about self-harm a self-harm risk assessment. And then we have FOCUS also has two different behavior threat assessments, one for behavior threats that are witnessed by the students, and then one that identifies whether a student has violent ideation and is likely to act out in the future. Once a student is flagged and takes the survey, the sub-survey, they don't see, it doesn't tell them, oh, now you're taking a self-harm risk assessment, or now you're taking a behavior threat assessment. The student's just answering a series of questions. The overall screener is 25 questions. There are 3 questions that route them into the sub-surveys if they answer anything other than none, meaning they've never experienced that thing. They get an immediate flag. They're put into an escalation path, and a local protocol is activated that goes directly from the dashboards inside the platform, but also routes them to the BTAM team for identification and for support. If the student gets a high score on those sub-surveys, they are the highest risk level, and we use traffic signals that are pretty easy to identify. So if the student has really high risk, then a counselor reaches out to the student. This is again based on local protocol. A counselor reaches out to the student and parents within 48 hours. And so it really escalates. This child is experiencing suicidal ideations, and they need support now. This is something, again, there are suicide risk assessments, but they are generally only given when a student is exhibiting behavior. And so what we're able to do is screen every student in a school and identify which of those students actually has in elevated levels of risk for self-harm or violent ideation.
So you've clearly outlined or painted a picture of what happens when data is not enough. It's not enough to just collect the data and say, oh yes, we have it. We actually will do something about it and do something with this data, and that is the main goal of the BTAM.
Yeah, absolutely. Data alone really isn't enough, because data without a workflow, without what to do next, it really only increases risk. If we can identify risk, but we don't have a documented pathway for response, we don't know what we do next, then you've really just increased exposure rather than reduce it. So what protects districts is not awareness, it's documented, consistent action. And that's what Focus does.
What do you think is something that school districts consistently underestimate? Is it the students, like the silent student who doesn't speak up, or that somebody is about to have a violent reaction? Or is it just undertaking this to prevent it in the first place, to prevent any kind of self-harm or violence in the first place?
It's a really important question, and one that we grapple with quite a bit, because what we found historically from our climate surveys is that we have hundreds of students across our district that really are suffering in silence. Mm-hmm. Unfortunately, we don't know who they are because it's an anonymized survey. And that was really the most alarming thing. Traditionally, we've been just trying to figure out how we increase climate, increase access to supports for school. But I think districts really do underestimate the number of students who are in need of additional support. Districts also underestimate staffing needs. And when they go to buy a screener or buy something, they think buying it equals implementation, which it doesn't. All of these things, though, leads to a delay in parent communication. It leads to a delay in actually supporting the students.
What's the hardest lesson you've learned in the last few years?
I think in my work, really focusing on trying to identify students that need support before it turns into a crisis or an outward behavior. My hardest lesson is that prevention is just not a one-time event. It's really a recurring commitment operationally and through support mechanisms. But without something like Focus that helps us quickly see any student that needs support, it's almost impossible. You're almost just left to wait until something happens. And that's heartbreaking for educators, because we love our kids. We want them to receive the support they really need.
So it's budget season, I understand. And you mentioned that sometimes the districts think something like this comes with a price tag. Is there help for districts to adopt something like Focus? I think there's grants or something like that.
Yeah, absolutely. And in Georgia, along with House Bill 268, there have been school safety grants. There are grants available from the federal level. There are private grants available. And the real thing is that if you consider what it does and the minor costs, considering how you're able to identify students, it really is a small price to pay. And there are funds, particularly school safety funds out there, that can help you embed this into or create the infrastructure to really support students by screening them.
So there's a couple of deadlines coming up. June, July of this summer, school districts have to have something in place, and then next January, something else in place. Can you explain a little bit what those two deadlines are?
Yeah, so by July 1st, districts are supposed to have their safety plans updated with BTAM teams and protocols around BTAM. And then by January 1st of 2027, it's fully operational, where really mental health is at the forefront of this behavior threat assessment. And it's not just reactionary anymore, it is preventative. And the heart of that, the only way to know who is likely at risk to ideate on these behaviors is through a screener, is through identifying those students. And so it's really important that as school districts work through this process and establish these protocols, that they think, what is that piece of data that we're missing? We have our office discipline referral data. We have notes from the field, so to speak, about trends and things we're seeing happen at schools. But what about that gap, the students, the 20 to 30% of students who are suffering in silence, that through a self-report screener like Focus can really surface those and support those students, which overall increases climate. It reduces, of course, risk for students' safety. It really increases well-being of all students because students come to school in a more supportive environment.
Well, thanks, Stephen. This has been great. I really enjoyed our time today, and I look forward to continuing the conversation with you and with others. As a closing, any advice that you have, what is the first next step that districts should be looking at and taking to be sure that they're compliant by this summer?
Yeah, it's already law. And I would say the most important thing at this point is to not delay building the infrastructure that you're going to need. These things take time, funding, of course, finding the money, but also making sure that we have a plan. And really, House Bill 268 isn't asking whether you care about safety. It's asking whether you can operationalize it in a structured way that supports all students. So you want to build the system before you need it, before that deadline, because of course the worst time to test your process is once a crisis occurs. So Focus isn't a silver bullet. It's infrastructure that allows districts to operationalize what House Bill 268 is asking them to do.
Fantastic. Thank you so much, Stephen. And we will do this again soon.
Thanks, Amy. Take care.
You.